Go ahead, ma'am.
Hello, good afternoon, everybody, and welcome to today's Facebook Live. I'm Dr. Rashmi Niphadkar, consultant at Pune Oasis Fertility. Today's Facebook Live session is about fertility window. So let's start by understanding what exactly is your fertility window. It is the time in which your fertility at its peak, the implantation is at its peak. So that means that the chances of you getting pregnant are at its peak in the fertility window. So it's really important to understand how we calculate this fertility window. What is your own personalized fertility window? Is there any difference between your fertility window and somebody else's? So all these factors are really important to understand when you're understanding your fertility. So let's begin by understand the physiology behind it, right? What is a normal menstrual cycle? Now menstrual cycle begins from the first day of your period. So the first 5 days you're going to bleed. From there onwards, follicle stimulating hormone is going to come in your system and your eggs are going to grow. While your eggs are growing, your eggs are also giving the hormone estrogen in your system. What is this estrogen doing? It is acting on the endometrial lining of your uterus and it is growing. Around mid cycle, when one dominant egg has come into the picture, this egg is going to rupture, or what we like to call as ovulation is going to happen. Now the second hormone of your cycle comes, that is progesterone, and this progesterone is the magical hormone which is going to prime your endometrial lining. Remember, estrogen has acted already on your endometrium. It has grown your endometrium. Now this progesterone is coming into your system, and what it's doing is it is making your uterus or the lining of the uterus susceptible to implantation. So these both hormones, estrogen and progesterone, are crucial hormones for your fertility window. Only when both of them have acted well, we call it that your fertility window is this XYZ days, because estrogen has come into your picture and progesterone has also come into the picture, and both of them are going to make sure that your uterus is ready for the egg that is fertilized, right? So estrogen and progesterone both have come into the picture and have made your lining ready for implantation. And so that is why we are calculating your fertility window, because we want both these hormones to act on your system. Now everybody's cycles are different, and it's very easy to calculate those women whose cycles are regular. But this fertility window calculation gets a little bit difficult if your cycles are irregular and erratic, right? So the peak fertility is around ovulation. Remember, estrogen has already acted and progesterone comes into the picture only after ovulation. So at the time of ovulation and 3-4 days around it is when we calculate your peak fertility. So that means if your cycles are around 28 days, your fertility window is from around day 10 to day 14. If you're somebody who has shorter cycles, if your cycles are, let's say, 24-day cycle, then your fertility is going to be from day 10, day 8 to day 10, something like that. And if your cycles are longer, suppose you're somebody who has 35-day cycle, 36-day cycle, then your peak fertility window is going to be, let's say, from day 14 to day 18, something like that. So depending on how long your cycle is, that is how we want to calculate your fertility window. Now, how do you by yourself track your fertility? Is it possible? First of all, the answer is yes, very much so. You can track your fertility by yourself without help of a doctor as well. So let's understand how to track your cycle. And the first method that I want to discuss is the calendar method. Now, this is the easiest way to track. It is also a little bit dicey because you don't really know what is happening inside your body. You're just going to keep a track of your calendar. You're going to write on your calendar the start of your menses, and you're going to write how when your next menses come. So that is going to be your cycle, and you are going to calculate your ovulation time, which is around day 10 to day 14, and you're going to consider that as your fertility window. So that is just the calendar method. Now this only works if your cycles are regular, so it's really important that you use this method only if your cycles are regular. If you're somebody whose cycles are irregular, suppose you have underlying PCOD, suppose you have thyroid issues, suppose you have prolactin issues, then your cycles are going to be erratic and it's very difficult to map your fertility window. The most important reason behind this is because egg growth is not happening at the correct time. So ovulation is not happening at the correct time, and if ovulation doesn't happen, remember, the estrogen and progesterone is going to come erratically in your system, and your endometrial lining is not going to be primed, and that is why your fertile window cannot be calculated. So this is also to make your life easier. You have many ovulation trackers apps available digitally these days, so you can actually track your cycle and you can know your fertile period. So that is the easiest way for anybody who is starting on their fertility journey. This would be the most simple way to track your cycles and fertility window. The second and a little bit outdated method is the basal body temperature. It lies on the principle that whenever you come near ovulation, the basal body temperature rises by zero point 0.3 to zero point 0.5 degrees Celsius. So, for this method, you basically need to use a thermometer. You need to use it regularly, daily. You need to keep a journal about your temperature, and then when it is slightly raised beyond the normal, you know you're ovulating, and you know that is your fertility window. But it's a little bit tedious method. You do have to keep doing it every day, so I wouldn't recommend that you go for a basal body temperature charting. The next and the more modern way to track your fertility is by using ovulation kits. So here basically you buy a ovulation kit from the pharmacy. It's available over the counter, and you use it, and then that tells you whether LH surge has happened or not. Now LH is the hormone that is responsible for your ovulation. So if LH peak has happened, that basically means that you have ovulated. You can consider it as your ovulation, and then you can do intercourse, so that you are keeping intercourse in the most fertile days of your cycle. So this is one of the popular methods that we see these days. It is a recommended method and quite foolproof, so you can go for ovulation kits. The fourth way to go around it is if you are in consultation with a fertility specialist, you can do serial ultrasonographies. This is what we tend to do in ovulation monitoring cycles. So what we are trying to do is we are going to track your egg that is growing in your ovary, and when that egg has reached dominance, either you can wait for natural rupture and ovulation of the egg, or you can take an injection for the rupture and then keep intercourse. So basically that's the most foolproof way to make sure that you're keeping intercourse at the right time in your cycle. So that is sonographic monitoring of your peak fertile window. And then there are some other tests like blood hormonal tests. You can do a mid-cycle LH test, that is luteinizing hormone, which is responsible for ovulation, or you can do a progesterone test, which basically rises after ovulation. So, you know, progesterone has come into your system. So, there are these different hormonal assays that you can do just to track your ovulation. But again, these are invasive. So, every time if you have to give a blood test just to track your ovulation, that's a bit too much. So, these are not routinely used. So now the most popular method is ovulation kits or calendar method. And the second popular method is sonography. That is if you're visiting the fertility specialist. There's also one last method, that is the cervical mucus method. And basically it lies on the principle that whenever you have ovulation, your cervical mucus will get stringy and slippery. Now this is your body's response in order to accommodate the sperms that are coming into your system and help propel them upwards into your fallopian tubes. So you can go by the cervical mucus method as well. So you know that once your cervical mucus becomes slippery and becomes stringy, you know that you have ovulated, and then you can do intercourse, and that would amount to your peak fertility window. So that is another method, although it's not very foolproof, and many people do not understand how your cervical mucus has changed. So again, I wouldn't say a very popular method for doing it, but then still a method nevertheless. Now, why is it really important, to know your fertile window? First of all, it's really important to understand if you're ovulating, because that is the most important thing that is going to help you get pregnant. Because if your eggs are not growing, if your eggs are not ovulating, there is virtually no chance that you're going to fall pregnant. You need an egg in order to get pregnant. So once you start tracking your fertile window, you're fairly certain that you're ovulating, and your chance of being pregnant goes up by itself. Second most important thing is why you should be tracking your fertile window is because your eggs after ovulation survives in your track only for around 24 hours or so. So you have that small of a margin to get pregnant each month. So it's really important to know that your egg is ovulated and the egg will really survive only for 24 hours. So it's very important to time your intercourse that way, and that is the important factor why you should know your fertility window. Now let's talk about how we track your fertility window during your treatments for infertility. So there are basically three treatments for infertility. One is ovulation monitoring, second is IUI, and third is IVF. So what are we doing? In ovulation monitoring, we are growing your eggs, we are rupturing your eggs, and then we are asking you to keep intercourse. So that way we know your fertile period and we are telling you to keep intercourse during your fertile period, so that statistically your chance of pregnancy increases by default. So that's the natural cycle. Now we recommend you go for natural cycle if your ovarian reserve, that is your egg follicles, are good in number, your sperm count is good in number, you don't have any other factor like a tubal factor or endometriosis or any other thing that is going to hamper your fertility. So if it's a clear cut case, this is the best way to statistically fall pregnant earliest. The second treatment that we have is IUI. Now, in this treatment, what we are trying to do is we are trying to grow the eggs. We are giving you injections to rupture your eggs because we want to time the IUI properly. And in IUI cycle, we are collecting the sperms, we are washing the sperms, and then we are putting it back into your uterus. Now, this is another great method to be pregnant because, again, statistically, it gives a great chance for pregnancy. We are washing the sperms, so we are overcoming any mild sperm problems as well. We recommend you go for IUI if you have not been trying for years altogether. Again, you have good ovarian reserve. Again, your sperm count is fairly decent. No major factor has been identified in your case as the cause of infertility. Then this is a really great method to help you be pregnant. And the third and the last treatment is IVF. In IVF, what we are doing is we are growing your follicles. We are doing an ovum pickup. So that means we are taking the follicles out of your body. We are doing the procedure of ICSI, that is, we are mixing the sperm with your egg and forming embryos. We are storing the embryos. And in your next cycle is the work we are doing with priming your endometrium. That is, we are giving estrogen. When the estrogen is acted and we have grown your endometrial lining, we are giving progesterone injections to make the uterus susceptible for a pregnancy. And then we are transferring back into this. So we are making sure that your uterus is in the best possible condition. Something, the job that is done in your fertile window in the natural cycle, we are doing in IVF, and then we are going to transfer. So again, your fertility window is taken care of. In cases when we see that IVF has also not worked, we like to do a test called as ERA, that is endometrial receptivity array. Now what this test does is basically, again, it's telling us the window of implantation or your fertility window. So basically what we are doing is we are giving you estrogen, we are giving you progesterone, and we are taking an endometrial sample out of your body. This sample goes to a genetic testing lab, and we are conducting test on it and telling you your personalized implantation window. That is when the embryo will be best receptive by your uterus is the ERA test. So in all these different methods, in natural cycle, in IUI, in IVF, in ERA, what we are basically trying to do is we are trying to give you a good fertility window, a good window of implantation. So we are trying in all cycles, the game is still the same. We're trying to grow your eggs, get the best egg to ovulate, get the best sperm out there, make sure your uterine lining grows the best. And when the timing is absolutely right, that is in your fertility window, we are transferring the sperms or we are transferring the embryos. So it's very, very important to understand your fertility window. It's the thing that you should know. So that's it about fertility window for today. I would love to have questions about fertility window or any other question regarding IUI or IVF. Below given is our fertility helpline. You can call anytime and ask any more questions as well. Okay, so which is the best day to conceive during the fertile window? Now, the best day to conceive is around your ovulation. As I said, your egg is actually going to stay alive in your system only about 24 hours. So the best time to conceive is during your ovulation time, immediately next to the ovulation. That would be so. That is why it's really important to understand when you're ovulating in your cycle, right? It's all connected. So that is the best day to conceive during your fertility window. Now that said, would you not conceive if you know you've missed your fertility window, or if you're 2-3 days early or 2-3 days late and you have intercourse, would you not conceive? Yes, the chance of to conceive is always there, but what we are talking about is your peak chance to conceive. The time during your menstrual cycle when you're the most likely to get pregnant is your fertile window. So I hope that answers the question about the best day to conceive during your cycle. How to calculate fertile days for irregular period? Now this is going to be really tricky because very rarely can you calculate it via the calendar method. One way to go about it is to keep doing ovulation kits monitoring. The best way to calculate fertile days for irregular period is to do an ultrasonography. It is the cheapest way to go about it. It is the way in which you will be most sure about your ovulation. So for irregular periods specifically, I would say sonography is the best way. The second best way is ovulation kits. None of the other ways will actually work as well in irregular periods. So that was it about your irregular cycle. So it's really important to understand. First, you have to track whether your cycles are regular and irregular. The way to track your fertile window in regular cycles is different from the way to track your fertile window in irregular cycles. So understand which category you are in and then go about it, and that will really help you. So that is it about your fertility window. You can give us a call on the helpline numbers, or you can directly take appointments as well. In Pune, the Oasis centers are at Wakad and at Kharadi as well. Thank you so much for tuning in.